All right. Well, good afternoon, everybody. My name is Lynn Martin. I'm a professor in the Department of Health Sciences at Lakehead, and I'm also a member of the EPID at Work Institute. And in case you don't know, EPID at Work stands for Enhancing the Prevention of Injury and Disability at Work. We would like to start our EPID Talks session today with a land acknowledgement. So the EPID at Work Research Institute respectively acknowledges its location on the traditional lands of Indigenous peoples. We acknowledge we are currently on the traditional lands of the Anishinaabe Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. With that, I'll now say welcome and thank you all for joining us for today's EPID Talks. Here at EPID, we really are all about collaborating with and sharing our research with the community. And we've got a lot of different people attending today, some in person and some virtually via Zoom. And I apologize again for not being there in person today. I'm feeling a little bit under the weather and just thought should not spread the germs in the workplace, preventing some kind of injury to other people or disability. So just a few housekeeping items. Just know that we're really interested in hearing your comments, your questions, about this session, as well as your ideas for future research. And we've built in some time following Adam's presentation for discussion and to respond to questions that do arise. And so if you are joining virtually, please do put your questions and comments in the chat. It will be monitored, and we will make sure that your questions aren't missed. So without further ado, I'll introduce you to today's speaker. It's my pleasure to introduce Adam Banner, who will be doing today's EPID talk. He's a health sciences doctoral student and a research assistant with Lakehead University. His research program is dedicated to improving the health of marginalized populations, including older adults and individuals receiving hospice and palliative care. And in addition to his doctoral studies, he works as a research assistant for the EPID at Work Research Institute. Outside of assisting with data collection and analysis for the Northwestern Ontario Worker and Workplace Health Study, he's also conducting a randomized control trial where he's testing the effectiveness of a mental health stigma intervention in the workplace. So busy guy. Today, Adam will be sharing insights from his latest project, which examines employment and trends and the factors that are influencing employment among individuals with intellectual and developmental disabilities. So please join me in welcoming Adam. Over to you.
All right. Hello, everyone, and thank you very much for the introduction, Lynn. So today I'm presenting the findings from a project where we're exploring employment among persons with intellectual and developmental disabilities, IDD. So again, this is a project going on in EPID at Work. This is a research institution here at Lakehead. Stands for Enhancing the Prevention of Injury and Disability at Work. EPID is everything and anything workplace health, and including the employment and health among marginalized groups as well. So we're very well suited to answer questions about this topic, about these populations, and this is why the New York State Office for Persons with Developmental Disabilities was interested in employments among persons with IDD. So a little bit of background. What is IDD? So IDD stands for Intellectual and Developmental Disabilities. These are conditions that you were born with, or present during your childhood development, and are lifelong. So when you say IDD, think things like autism, Down syndrome, cerebral palsy, or fetal alcohol spectrum disorder, just to name a few. Developmental disabilities is sort of an umbrella term for categories that affect your intellectual functioning or physical functioning or both. But intellectual disabilities specifically refer to conditions where cognitive functions, your intellect, is impaired. So I'm not going to make you close your eyes, but I just want everyone to imagine someone that you knew with a developmental disability. So picture someone with autism or Down syndrome. So a lot of you probably are picturing a child. Now, some people here also might work with people with IDD, but the reason I bring that up is because it's very easy to forget that with this population, These people grow up to be adults, just like you and I, who want to live and have fulfilling and lead independent lives. And the ability to do so often depends on a person's, the severity of a person's condition, as well as the condition itself. Outside of that, there's also many social and societal factors surrounding a person that influences someone's ability to do that. So, which is why I want to bring up the idea of intersectionality and intersectionality theory. In brief, intersectionality is the idea that we're just more than just a single identity that makes up who we are. We're a combination of all of our different identities. So whether that's so someone's more than just a man or a woman, someone their race or ethnicity, their educational background, their employment status, income, all these factors come together and essentially shape a person's lived experiences. Typically, intersectionality has been very well explored by qualitative research because of its very nuanced approach in describing people's experiences. But as quantitative researchers, we absolutely, not only can we, with great statistical methods, we should be exploring some of these issues using an intersectional lens. So in the context of disability, someone's status as a disabled person will also intersect with a lot of their social factors and other clinical factors. So everything from their gender or sex, their built environment, food security, income, education, and of course, employment. So why employment? Why is employment important? And frankly, it's a fundamental building block of a person's ability to not only just have an income to survive, but to also truly live their life. So that includes autonomy and having independence and control over what your day-to-day looks like, the ability to pursue your passions and feel fulfilled, and a reciprocity with society around you. Of course, unemployment sadly is associated with poverty, as well as a whole bunch of poor health outcomes for both physical and mental well-being. Specifically for people with IDD, employment is a very important factor and a big determinant and influencer on whether someone is able to lead an independent life and have autonomy over their day-to-day life. It's a very important building block for people. And typically when we're talking about IDD, there's two kinds of employment. There's competitive employment, which is pretty much just every and any job in the community. Could be your job, could be mine, could be in the trades, could be retail, anything. So these are jobs that are where you're employed at, hopefully, a competitive wage, and you're in the competitive job market and are open to everyone and anyone with or without disabilities. Supported employment, on the other hand, is meant for people typically with more significant disabilities and helping them get to a state where they can be competitively employed in an environment. That process typically looks like hiring a job coach, or rather being a part of a program where you're matched with a job coach who essentially gets to know a person, their needs, their strengths, where they also may need a little bit of support, and most importantly, what they want to do and what they want to do in life as well. They essentially play a matchmaking role with local employers and provide on and off the job training, and eventually support a person to become fully independent in whatever work they're doing. So what do we know currently? Well, we know that employment rates are lower among people with IDD, but how much lower is a little bit of a mystery, because literature reports a very wide range of employment rates. So, for example, this recent systematic review looked at employment rates anywhere from 14 to 65%, which frankly is a very useless range because that's a variation of 50% depending on the study. And there's other studies that include numbers that are wildly different than this as well. So why is there such a big range? It's primarily to do with issues surrounding and inconsistencies surrounding terminology of what is IDD, and similarly, what sample of people they're drawing from. A lot of these samples do not use population level data. They're usually sampling a niche group or using questionable terminology or even outdated terminology to define people in that group. Special education needs is an example of a term that some studies use, but that includes people with and without intellectual and developmental disabilities. They also might describe more niche populations. So for example, adults with autism and mild intellectual disability, which again, may not be applicable to the whole population. And that's why these rates range quite a bit. So we also know that, of course, someone's clinical factors and their sort of functional status very much affect someone's ability to be employed. Again, one of the issues that we're encountering with a lot of these studies is that they're not very well defining what severity means and how they're measuring that. So severity and level of disability is a very broad concept, it's very multifaceted, and it really should be broken down into different components. Someone's cognitive impairment, someone's communication abilities, someone's behavior, for example, as well, someone's ADL, so that's activities of daily living, the ability to dress oneself, toilet oneself, things like that. IADL is more instrumental activities of daily living, so that's things like managing finances, etc. Again, it's not just one measure or of level of disability. These people deserve more nuance than that. Again, we also know that some personal and social characteristics studies have identified, for example, people identifying as female or with minority groups or just anyone with low income or SES, that affects their employment rate adversely. We also know that the environment in which someone is working is an incredibly important factor in whether or not they're going to be employed and stay employed in a given space as well. Again, so anything, this could include things like access to job coaches and on-the-job support and training, and just overall just having supportive environments. So again, some of these gaps are very poor and inconsistent definitions of what IDD is, not using population level data. There's very rarely validated scales being used in these studies to identify people's severity of their condition. They're not breaking it down. There's very little nuance, and certainly very few studies are considering intersectionality. At least quantitative studies are not really doing that. So this is where this study comes in. We aim to describe the employment rate of adults with IDD using population level data and describe the personal, social, and functional characteristics associated with employment. Somehow I'm almost done this. So our data source, we're using population level data from the state of New York. So we have a population or a sample size of over 50,000, which pretty much represents the entire population. All this data is based on the Coordinated Assessment System, the CAS, which includes 300 items or 300 plus items related to the person's social, basically social factors, personal factors, functional and health characteristics. The CAS is based on the Inter-I ID, so Inter-I assessment tool for persons with intellectual disability. So this is a very, very validated assessment tool for use and to understand and quantify the needs, the preferences, and the strengths of people with ID. Again, this CAS uses this scale, uses all the scales and things in the Inter-I ID as its foundation. So our outcome of interest, we're looking at employment status. We're looking to see whether someone is employed in either a competitive or supported setting. Some of the other variables we're looking at and we're interested in seeing the effect of, so we have social variables, so sex, age, living situation, and ethnic minority status, as well as clinical and functional characteristics. And again, these are all validated scales, so the severity of intellectual disability, someone's cognitive performance, their ADL capacities, their IADL capacities, their communication skills, their aggressive behavior scale, as well as the depression rating scale. So basically, we're going to do a simple description of the study, just describing, or sorry, of the population, describing unemployment rates, or rather employment rates, just quickly doing by varied associations. And we're really interested in looking at some of these factors through multivariate logistic regression to see which are the most important variables. We're also going to take an intersectional lens as well, looking at the interaction of sex. So what we found was that 13% of adults with ID were employed. And all these factors that we included were relevant in determining employment outcomes. Found that, oh, where are my notes? Okay, well, we found that, from memory, I guess, we found that most of the study population were male, were aged 25 to 44, lived at a private home, were not ethnic minorities. I believe this I don't remember. I believe they had more moderate levels of ID severity, mild cognitive performance, and they were independent in their ADLs but needed more support in their IADLs. Most had communication impairments as well, but most did not have aggressive behavior or depression. So some of the characteristics included that were associated with higher odds of employment. So people who were more likely to be employed were men. People aged 25 to 44 were people who identified as white. People had lower levels and severity of ID, lower levels of cognitive impairment, were more independent in IADLs and ADLs, and had lower levels of communication and aggressive behavior. For the intersectional approach that we used, we decided to use a stratified analysis of men and women after looking for some significant interactions. And essentially what we found was sort of interesting because men and women had very different employment outcomes depending on their living situation. So women who lived at home, so at a private home, were less likely to become employed than the women living in a care home or assisted living. While the opposite was true for men. Men living at a private home were more likely to be employed than if they were in a care home. And keep in mind, this is still while adjusting for all the other clinical factors. So functional status is not really part of this equation. So we're going to get to that a little more in a minute. But again, I just want to emphasize that severity and disability as a broad concept should be broken down. So that's again why we introduced all these validated scales, and we found we were able to show that severity of ID, as well as cognitive impairment, communication impairment, aggressive behavior, and needing more support in ADLs and IADLs were associated with lower odds of employment. As far as the social factors, so again, sex. So being a man increases your odds of being employed. However, you do have that difference between men and women, where when you consider living situations, which is that women that are living at home are less likely to be employed than those living in assisted living or care. Men living at home are more likely to be employed. So this sort of implies that there might be social pressure and expectations for women with ID to take on homemaking roles. They might be pushed towards these roles more so in a private home setting than they would be in a care home. Some studies have explored this and have explored how support, including parents, actually influence a person with ID to adjust to social norms and social expectations, to basically adjust their dreams to have more suitable roles. That's very fortunate and awkward finding, and frankly, this deserves perhaps more of a nuanced approach and further research which looks into that, perhaps using a qualitative lens as well. So social factors, so age. So basically younger age groups, so younger than age 25, as well as people who are older than 44 were less likely to be employed. This is pretty much because younger people are still more likely to be enrolled in educational programs, and older adults, of course, are more likely to be retired. The 25 to 44 is, I guess, represents more of a working age for people with ID. So again, and jumping back to older adults, people at 44 aren't typically retiring for the general population, but for people with ID at around age 40, you start to see some severe effects of premature aging. So again, someone with ID typically, someone with IDD typically at around age 40 starts to have a clinical profile similar to someone who's already a senior. And you're already starting to see some of the negative health effects, which affects ultimately someone's ability to be employed as well. So identifying with a minority ethnicity was also associated with lower employment rates. So there are plenty of social inequities and inequitable access to support, which are the driving force behind racial and ethnic disparities in employment rates among people with ID. So literature has looked into this a little bit. It's largely to do with access to things like vocational rehab and support services as well. But some studies found that when you adjust for some of these factors, race and ethnicity is no longer consistent, but that is not a consistent finding across all studies. So that implies there's still definitely levels of discrimination in addition to just the social inequities as well. So present limitations of this study is that we're not looking at individual workplace factors that affect someone's ability to sustain their employment or become employed. That was out of the scope and something that's also not included in this data. We're also not considering things like rurality yet. And we also don't provide any sort of stratified results by condition. So for example, we're not reporting the important factors for people with autism compared to Down syndrome, compared to different conditions. Yet. I'll get to that in a moment. So strengths. So again, we're filling a gap as one of the first studies to do this and answer this question with population level data. We took the intersectional lens and we have a very comprehensive analysis because of the variables we have access to. Again, we're using validated scales to describe clinical and functional capacities as well. And I do think that we did a fairly comprehensive analysis. So in addressing some of these limitations, this is actually not a cartoon. This is actually a photo of me doing the study, because there was one problem with big data. As much as we love to say that secondary data analysis is easy, it's great because your data is already there. Well, when you're dealing with something that's so big, it has its challenges. Again, we had a sample size of over 50,000 and we had hundreds and hundreds of variables. So data can be too comprehensive. That is a thing because there's privacy concerns. When you have data that's so big and so descriptive, you can start to identify people quite easily. And the problem with that is that when you're talking about data that is between organizations, sometimes you have different standards in how this data is reported and what variables you're even allowed to have access to. A lot of people dealt with Chi know about this. So again, especially when this data is from the Office of Persons with Developmental Disability in the state of New York, they have different standards than, say, INTRI might hold their data. So how do you navigate this? How do you navigate differences in policies? And also, how do you avoid differences between, problems with large data migrations when you don't have a shared data holding agreement? Basically, you can end up with problems like missing variables or missing data dictionaries or just simple coding errors, because data that is linked can be very messy and very hard to deal with. So what's the solution to that in a lot of cases? Is shared data holding agreements, where you all have the same access to the same data. You don't have to rely on these downloads or awkward waiting periods and reaching out to people and policy disputes. But that also has its downsides, which means it usually requires more resources, more time, and then now you have to get lawyers involved. Lawyers are also expensive, and drafting these sort of agreements can be very laborious. I mean, even though ultimately it's better and it allows for streamlined partnerships, it does have its challenges as well. It's been a long time coming between INTRI and the state of New York to have a data sharing agreement. Finally, an agreement has been made to share data, so now these processes will be a lot easier. So now we'll be able to add variables and proxies for things like rurality. We'll be able to have access to variables for people's individual diagnoses. So we'll be able to do stratified analyses for looking at the important factors for people with, for example, autism. Yes, again, so we'll also be able to look at employment in competitive versus supported settings, and even by residential status. We're going to be just doing more further analyses because we really want to report on these nuances, especially because of how somewhat neglected this topic has been in the past. So again, overall, we found that 13% of adults with ID are employed. We found that social factors, even when adjusting for all the functional and clinical factors, are still very relevant and determine a person's odds of employment. Again, this serves to highlight social inequities, and more grassroots studies may be useful to investigate this further, particularly that interaction with sex and living arrangements as well. So functional and health characteristics, of course, as very well predicted, were very, very robust determinants of employment. So again, we broke down just level of disability into individual validated scales. And this is useful to understand the population as on the population level, but as well as when you're considering the effects for an individual, it's important to have these nuances and understand a person's clinical profile, basically their strengths for employment, as well as where they need support. Which is something I want to emphasize, is the idea that these factors should not be thought of as weaknesses. Arguably, we all have weaknesses, and for example, mine, I do believe is public speaking. But to be honest, I did have a lot of support. I've obviously had a lot of people come out, and I really, really do appreciate that. And I'm privileged to be able-minded and able-bodied. So this is why, again, especially for marginalized populations, especially such as people with IDD, support is really what matters. And that's why I want to emphasize that all these factors that were identified should not be thought of as weaknesses, rather instead opportunities to provide support so that people can lead independent and fulfilling lives. Thank you very much for listening.
Thank you so much, Adam. I really appreciated the talk and the presentation. I'm not seeing any questions in the online chat. So maybe what we can do is just open it up. If people in the room want to ask some questions, I might rely on Adam to, just find people and answer their questions. But I'll continue to monitor the chat if there's anything online, and feel free to raise your hand online as well.
Absolutely. Go ahead.
I have a question. Thank you. Thank you for that, Adam. So in the beginning of your talk, you said that there's many different ways of defining IDD, and that was what you thought was one of the challenges of determining the prevalence of people who are employed in that group. I'm just wondering, for your study, how did you define IDD?
So basically, we so that was any condition that you're born with lifelong and affects your development in terms of your physicality or your intellect. So and there's a long and comprehensive list that the state of New York has for including as well, and they also include people who don't. There's also some more rare conditions as well that fall into other categories. So basically, they have a very long, comprehensive list, and all this data comes from people who receive services from New York. So whether that's home-based, again, a lot of the people in the survey, the study, were from a private home. Some of them were also in other forms of care, so long-term care homes and many other facilities that we condensed to the different categories. But yeah, that was our definition of that.
So anybody who receives services would be given the assessment?
Yes. So yeah, anyone receiving these services are given this assessment. And that's the idea.
And then how did you define employment?
Define employment. So basically, as part of the assessment, people are asked about their employment status. So the assessment is done conversationally rather than just filling out just a questionnaire. So it's all self-reported data, but they have typically someone going through that. They will always have someone going through that with them. So it's typically a person who's trained to give this assessment. So they're basically asked about their employment status. So whether it's a competitive setting, a supported setting, a vocational rehab. We also have a variable that includes, for example, people who are employed, people who are unemployed and looking for employment, people who are also unemployed and not looking for employment, because there is potentially a difference between those two groups.
Okay. And this is a cross-sectional study, so it's at one point in time, basically, are you employed or are you seeking employment? Exactly.
And now, so we want to start off with a cross-sectional, though a lot of the data is longitudinal, because these assessments are given. I don't remember what the interval is, but these assessments are given. So we do have longitudinal data for some of these people, but it wouldn't be, I don't think it's all 50,000 necessarily, but we do have repeat assessments. So again, it might also be interesting to look at factors that are associated with sustaining employment, because just because you get employed doesn't mean you stay there necessarily too, especially if you have a troubled background or don't have access to the supports that you need.
And do you have a sense of if it's part-time, full-time employment, or do you have that level of information?
That's a good question, but I don't know if it breaks down between part-time, full-time. I actually don't remember that.
It doesn't.
Okay. Thank you. The expert. Yes.
I'll be that person who asked you a question. I'm sorry, Adam.
Great.
But you mentioned the social factors that may influence employment for women, like living at home, you said, and like
Yes.
parental influence as well. This is like an opinion-based question, but do you think there are cultural differences between employment of people with IDD?
That's a very good question. Yeah, there could very well be cultural differences. Again, I don't know. Yeah,
It's an opinion question.
yeah, no, I think it very well could be. Absolutely, especially, I mean, yeah, I think because there are stigmas surrounding IDD. There's also, I mean, even religious values can play a role there too. But I think it's just generally just in society, just women, especially women with disabilities, are just encouraged maybe not to pursue their dreams because they're thought of in a way that they can't. Even when we clearly see that even adjusting for clinical factors, well, that's not the case. It's not that they're, or more disabled. They're just not given the same opportunity, the same shot. So it's possible, yeah, cultural may play a role in that. Yeah.
First of all, thank you, Adam. It was an insightful session. I have a question about comorbidities. Are you considering, or you mentioned about your future plan of stratified analysis? So will you be looking into the comorbidities because IDD, in literature, it has been reported like it has comorbidity with other psychological conditions, something like depression, anxiety, or even more severe ones, schizophrenia, even with the medical conditions such as epilepsy or something. So do you have any plan or is there any studies?
Yeah, absolutely. So yeah, I mean, to reiterate, absolutely, people with IDDs are more likely to have also a lot of other comorbid conditions as well. That was, I believe, one of the things that we didn't have complete entries for. I think that was one of the variables we had problems with but the CAS does report on individual diagnoses outside of what the main ID diagnosis is. They also report on they'll report on heart conditions, cancer rates, anything, and also as well mental health conditions. For the time being, we just included functional status, so we may not get any more variance explained by including those variables because we're already at something like 93% of variance explained with the variables that we included. But that would be interesting to look at too, and that's absolutely something we want to look at further in our analyses. Whether ultimately at the end of the day it provides any more descriptive power, we'll see. But
because I believe that population would be having more complex challenges in employment.
Oh, they absolutely do.
With the
absolutely. Yeah, different access as well, and it does make things tougher, definitely. Yes.
I have a question. Good job, by the way, of
Thank you.
to your presentation. More so about kind of like the category of supported employment.
Yes.
I was wondering if that also considered like, so yeah, like you can get certain accommodations at work to help you do the work and whatnot, but does that also consider possibly sometimes having someone who does that like high functioning, IDD, but they still need to perhaps bring like a support worker to come with them to the workplace that could further limit their opportunities for certain jobs because now you're no longer bringing in just one person. You have to bring in a kind of like secondary person that's not necessarily employed by that workplace, but by another workplace to help this person do their job. Like, has that in any capacity been like explored how that could affect stuff?
Oh, absolutely. So that wasn't a huge focus for our analysis because we're just looking at the employment rates, but absolutely, yeah. I mean, a big trouble is that even access to supported employment programs is very limited, especially in certain areas too. And yeah, that will, of course, I do think that will affect someone's ability to be employed. And the reality is that even in the background literature search for this study, something that we found was that employers who have hired people with IDD, even through support, whether it's with or without the supported element, are more likely to do it again. However, if you look at the amount of employers who are actually interested in doing it in the first place, there's not a lot. They kind of they don't care, they don't want to. Oftentimes they don't even know what's involved, right? They don't know who pays who, and a lot of workplaces sadly aren't willing to take what they perceive as a hit to their business by including someone with IDD. So which is a very sad situation. Yeah, so I do think it does absolutely affect the chances people are given. Sadly. Yes.
Thank you, Adam, for your insightful presentation. So I have a curious question. So during your research, you mentioned about special education for the IDD persons.
Yes.
So do you see any linkage about the employment and the level of special education? So because I know that I have friends working on the education for special person,
Yes.
and also I see that maybe my daughter's class, they have children like with ADD problem. So I want to know if the education, do you see any like linkage between them, the employment and the
Right.
special education? Thank you.
Okay, so special education. So a lot of people in this population, not all, are going to be enrolled in like individual education plans and things like that. And in addition to that, there's also other factors like, are they pursuing higher education after that as well? That was, I believe that was another one of the variables that we did have missing data for, unfortunately. So I really wanted to look at that because yeah, absolutely, education will play a role. And yeah, and it's true, especially when we're considering things like higher education. Someone's probably more likely to be employed. Also, because they're more likely to have a higher overall functional status. Yeah, I think so. The closest thing we have to that, and something we did look at in again our literature review, is that access to things like additional programs like vocational rehab and very good support services is very helpful for sustaining employment as well as, of course, just gaining it in the first place. Yeah, of course. Yep.
I have a question. I was interested in so the participants in the study, from their perspective, how did they view employment at work, and the type of work were they doing was fulfilling, and did they work at long term?
Yes, yeah. So that's a very good question. There is actually a variable in there that discusses because the inter-ID, and that the CAS is based on, also looks at a person's preferences. There are questions asked about a person's preferences for change in their life. So they ask basically in all different domains of your life, what kind of changes and things do you want to see? So employment is one of them. So there's a variable called prefers change in employment, yes or no. Again, could be a bit broader, interpreted in a few different ways, but typically what that means is that, I guess, does someone want change in what they're doing currently, whether that's maybe from employed to unemployed, unemployed to employed, or just to work somewhere else. Yeah. So that I think that is actually that's a very good point. That is something that's very important because yeah, like you said, I mean, preferences, what someone actually wants to do, is a very important thing.
So this is Lynn. I think I'm still a disembodied voice. I'm not sure if there are more questions, but I do see a couple of questions in the chat room. I did answer one. Manila had a really good question around wondering whether or not we were able to look at where people were employed, like the industry, knowing that it might be easier in some industries to accommodate or to support people with developmental disabilities than in others. And so I answered that no, we don't have that kind of information in the data. One of the things that Adam spoke to very well was the data is comprehensive, and even though there's over 300 items in the assessment that they're doing, it is considered to be a minimum data assessment. So we ask about employment status and employment arrangements, and people are likely taking notes on where they're employed and those kinds of things, but that's not in the actual assessment because it would lead to identification and we need to avoid those kinds of things. So we don't have that, unfortunately. But the second question, Adam, that came up was around from Sam, saying that there's a large sample size and wondering if there's the possibility of having two people in the same household in your data. And if that possibility exists, how you would account for that correlation in your multivariate model.
Yeah, that's a good question. So, especially for people in care homes, it's very possible that multiple people, that's probably the case where multiple people from a care home are getting the same assessment. Of course, if everyone is getting this assessment. So yeah, again, you could use modified Poisson regression analysis, especially because I mean some literature says that anything where you have an outcome that I believe is over 10% of your study sample, you're supposed to use not necessarily multivariate, just like regression, rather modified like Poisson regression in this case, because Poisson is usually linear, so we'd have to switch it to that's what make it modified, I guess. But so yeah, we could do that. Though sometimes that can make for some complications in interpreting the results. Particularly, it doesn't punch out odds ratios. It does punch out relative risk, I believe, but typically it's just used a little bit less. And but that's a good point. If I'll consider doing that, doing the Poisson regression as well to see if there is a difference just in crunching the stats between the two different modeling techniques. I'm not sure. I'm not sure if it would result in a difference. I think in this case, just because we're really just exploring the factors versus just trying to make the most concise and I guess the most sort of accurate model in terms of your just your variance explained and things like that. It may not offer that much more help, but it could be something to look at as well.
Yeah, thanks for that, Adam. I see that Jennifer has a question online. Go ahead.
Yes, hi, thank you. Can you hear me?
Yes, we can.
Okay, perfect. Yeah, thank you for that presentation. I found it really, really interesting. I'm coming from this probably from a different perspective. I do have work experience as a job coach working with people with IDDs. And I know just how tough it is for them to find jobs. A lot of them are contract or very part-time or on call, and they're not what you would like. They aren't like, they're just like general labor jobs. They're not like something like career type of jobs. They just don't get those opportunities, unfortunately. And then I moved on to employment specialist type of roles, working with these types of people or individuals experiencing these IDDs. So just kind of looking at the data a little bit, I'm just kind of wondering, like you did the study in New York. I'm wondering if that data is available here. Like I'm located in Toronto. I'm just wondering if there's data available here in Toronto, just because it's a little bit hard with the target population, kind of bringing that information and applying it here to Toronto, where it's like really multicultural. I know somebody asked a question about that, if that was part of into the study, like race and cultural identity. But I'm just wondering if that data is available here. And also, like where you see the changes that are needed to be made. Like a lot of it is education. We need to educate employers about the benefits of hiring individuals with IDDs. And we need to educate the government and make changes at the government level. I'm just wondering also from your experience and the research that you've read and completed yourself, what you feel is happening out there to make those changes for people with IDDs in the employment realm.
Well, thank you for the questions. Oh, sorry.
Oh, sorry, Adam, I didn't mean to frighten you, or I was going to say I can answer the data access question, and then I'll let you answer the other questions. But thanks for that, Jennifer. So the data are available. The data are owned by the state of New York and shared with INTRI as part of a data sharing agreement, and so they aren't available outside of INTRI. And they're only available in jurisdictions where the assessment instrument has been implemented. So it's being used in the state of New York to assess the strengths, preferences, and needs of everybody who's in service. So that by far is our biggest implementation around the world. There are 3 Canadian provinces that have implemented the INTRI ID on which the New York CAS system is based, but not Ontario. So unfortunately.
Interesting. Okay. Thank you. I think that needs to change.
Definitely.
Me too.
I'm really actually surprised by that we're not capturing that type of data. It's interesting. Thank you for that answer.
Yeah, thanks, Jennifer. Go ahead, and Adam.
Yeah, absolutely. Yeah, I mean, speaking on, I guess, where changes are sort of needed. Yeah, you mentioned, of course, the employers themselves as well as government. I think those are the biggest two groups. Government is always very reluctant to change. In workplaces, the more bureaucratic of places, oh boy, the harder it's going to be. There's a lot of local companies who and local businesses. For example, here in Thunder Bay, there's businesses who care and they do have these sort of programs, and they will absolutely hire people with IDD. And typically, and again, well, another thing that we found is that employers who do that are more likely to do it again and continue doing it. So I guess it really is about changing, I guess, people's perceptions of it. And also, I guess, even understanding a lot of employers don't know what it actually looks like to hire someone with ID, whether that's just straight through a competitive route. A lot of workplaces are not universal. And as soon as employers start having to think about accessibility, their head starts spinning because they don't even know what that looks like, or otherwise don't care to learn. So again, so that's why education about what that process looks like is very, very important. How we're actually going to do that, I think it's addressing stigma and possibly even getting employers who do hire and do consistently hire people with IDD from both the competitive route as well as supported settings, just to speak on their experiences and speak about the many benefits that their business has had because of hiring people with IDD, because there are very many benefits. I mean, first off, and the a big reason that employers support this is because it feels good to do that. It also, frankly, even from a business perspective, it looks good. And sometimes when you're speaking to people about just on the bureaucratic level, sometimes you have to emphasize not the compassionate points, but the points that are just relevant and going to help them, which is frankly, a big part of it is public opinion and showing that you care. And if we can emphasize that to especially larger employers, maybe they will start to be encouraged or even pushed towards making pathways and streams and basically ways for people with IDD to get hired in their companies. I can't think of any large employers that have that path currently. I know they probably exist. So I'm not really able to speak to that. As far as changes at the government level, yes, sorry.
Oh, no, I was just going to say that I think often, Jennifer, as I'm sure you know, and maybe others know, that social enterprise, parents working with, it's often parents, working with their kids to develop their own businesses in order to provide them with employment opportunities. And I think locally here in Thunder Bay, we've got an excellent example of that, where the Rowan Tree Collective was created by a friend of mine. Actually, she's got two sons who are on the spectrum, and a younger son, and they work with Both Hands Pizza here in Thunder Bay. Where they've got adults with developmental disabilities who are making the pizzas. So if you go and buy the frozen pizzas that you can get at different grocery stores from Both Hands, they are made by adults with intellectual and developmental disabilities. They also work in the restaurant as well, doing the serving, doing the cooking, and those kinds of things. So often what we see in the developmental disability sector is a lot of social enterprise, so businesses owned and operated by people with developmental disabilities, creating those opportunities for themselves, which I think also is a good way to demonstrate capacity. And I think, sorry, I don't mean to, jump in, Adam, but I think, one of the things that you can do with the big data, and even though we're using, New York data, we can eventually amalgamate that New York data with other states and the provinces that are using the assessment, but you can start to do things like multi-level modeling, where you take into account not just the urban rural status, but you can start to look at, organizing, we can identify people who all are receiving services from the same organization or in the same, roughly geographic region, and start to look at, do we see differences in employment rates, by those geographic locations, from one organization to the other, and then look to those organizations, look to those geographies to say, what are you doing well that we can replicate elsewhere to create those opportunities for employment in other regions? So sorry, I cut you off, Adam. I was just really excited.
That's great. I couldn't have said it better, so perfect. Sorry, I believe you asked another question, but I'm blanking on what it was. Did that answer everything, or
It
something
did,
else?
yes.
Okay,
Yes, thank
perfect.
you. Just, yeah, I kind of wanted to know your opinion of like where the data is going to take us and how we can kind of improve what's out there for people with IDDs. So thank you. No, I really, really appreciate that. Thank you. And great presentation again.
Oh, thank you.
I'm not seeing any more comments or questions in the chat, and I'm not sure, are there any other questions in the room?
Doesn't look like any, so it's good. All right. Well,
Thank you.
thank you everyone for the questions. And I guess please check out the Northwestern Ontario Worker and Workplace Health Study. I'm sure a lot of people in this room might know what it is, but as well for people online, especially check it out. It's a fantastic study. It's an ongoing cohort study investigating workplace health and factors associated with workplace health. It's one of the first studies to do this as a cohort, especially in Northwestern Ontario. So it's a very important study. Please check it out. QR codes.
Yeah, and I was going to say, Adam, on behalf of EPID and everybody here, I wanted to thank you for a really great presentation and definitely thought-provoking and getting people thinking about, the challenges that this specific population faces and the different changes that are needed at a lot of different levels. And I also want to thank everybody who joined us today. Thank you so much. Your questions, all these great questions and the feedback show that the community is really engaged, and that's so exciting. And before we close out this EPID talk, I want to let you know that, EPID really values your feedback on this event, and it helps to plan for future talks. And so we're hoping that you're able to take a minute to fill out a short survey. And I believe the QR code is up there. There you go, it's right there. And hoping you're able to do that. You can access it through the QR code on the screen. And let you know as well that the next EPID Talk will be happening in January. So please do follow EPID at Work on social media to keep up to date on events. We hope you all have a great and wonderful day.